Very good morning to all. I am Disha Mamniya. I am an optometrist. I have completed my Masters in Optometry from ITM University, Panvel, and am now pursuing my fellowship in Strabismus Management and Vision Therapy from Indian Academy of Optometry, Coimbatore. I am here today to share with you a case of convergence insufficiency that I came across during my practice. Here you can see all the instruments that are needed for evaluating this case. Let's evaluate his binocularity for distance without and with glasses. Please remove your glasses. Look at the dots from the third line below. Here we can see that on covering one eye, there is no movement of the other eye, which shows that there is no direct deviation, there is no manifest deviation which is present on covering one eye. Now I will do the alternate cover test to know if there is a latent or a manifest squint. If you see, there is very slight amount of exotropia which is seen for distance without the glasses, almost minimal. Let's now do the cover test, the direct cover and the cover uncover test with the glasses on. On doing the direct cover test, we see that there is no amount of tropia present. There is no movement of each eye is fixing perfectly. Now let's do cover uncover test. On switching the cover from one eye to another, there is no movement seen, which shows that there is no amount of tropia or phoria which is present with the glasses. Let's look at the ocular motility for distance. Please follow my torchlight. We see that the ocular motility is full, showing that the patient does not have any kind of deviations for distance. We will now do an evaluation for near. Now let's look at the deviations for near. This is the Hirschberg test where we will see the central corneal reflex. Here in this patient, it appears to be perfectly centered. Now we can do a cover uncover test to just see if there is any change in the position of the reflex on covering one eye. The eyes look slightly exotropic for near. On placing prisms with apex towards the deviation at around 6 prism diopters, the reflexes appear to be centered for both the eyes, which show that the eyes are slightly exotropic for near without glasses. Let's do a cover test for near without glasses. Please hold this in your hand. Look here at the view. Can you see it clearly?
It's slightly hazy, but I can see it.
When we cover one eye to see if there is any tropia present, there is no movement of the eye seen. However, on covering the right eye, a very small amount of left exotropia is seen for near. On doing a cover uncover test, we can see that this is a high degree of exophoria which is present where there is movement of both eyes seen, particularly more for the left eye. On doing a prism cover test for near, with apex towards the deviation placed in front of the left eye, we can see that with the 10 prism diopters base in, the movement of the eyes is stabilized. There is no movement of any eye outwards on covering it or inwards on uncovering it. Let's do the cover test with the glasses just to make sure if there is any change in the deviation. Please hold this in your hand. Is this clear? Okay. When doing the cover test with glasses on, there is no movement of the left eye or the right eye on doing the direct cover test. Now on doing the cover uncover test, we can see that there is very slight exophoric movement of both eyes for near. Which gives us an indication that probably the patient has a convergence insufficiency for near. Let's check the near point of accommodation and convergence. Please put this on your nose. Can you see this dot?
Yes.
Okay. You have to look at the dot and the line. I will bring this closer slowly. When it appears to be double, you have to let me know. Okay?
1.
Don't say anything. When it becomes double, you let me know.
It's double now.
Clear or double?
No, it is slightly hazy, sort of double.
Double. Here at 22 centimeters, we can see that the patient is seeing the line double. That means that his convergence for near is affected. Please close your eyes. Open. Clear?
Yeah.
Single?
Yes.
Now,
Now it's double again.
close your eyes. Open. Still double?
Yeah.
So at 19 centimeters, the baby has persistent double vision. That means the NPC, the near point of convergence of the patient, is receded. Let's look at the patient's near point of accommodation. Can you see these letters here?
Yes.
The third line in the letters?
Yeah, it's clear.
Okay. When I will get it close, it will be clear and then it will appear blurred. Okay?
Yeah.
When it appears blurred, please let me know.
Sure. Starts to get blurred. The last line, sorry, not the third line.
Look at the third line, please.
Okay, sorry.
Clear?
Now it's blurred.
Blurred?
Yeah.
Close your eyes. Open. Blur still?
No, clear. Now blur.
Blur?
Yeah.
At 15 centimeters, the patient is seeing the letters blurred. That means the near point of accommodation is also receded. On doing a prism cover test with glasses with apex towards the deviation, we can see that at 8 prism diopters, there is no movement of the eyes seen and the eyes are properly stabilized, which shows at 8 prism diopters of exophoria for near. Let's check for suppression in case if any present for near. How many dots are you able to see?
4.
Please specify the color.
2 red and 2 green.
Are they clear?
Slightly blurry.
But you are able to see 4 dots?
Yes.
Okay. Please close your eyes. Open only the right eye. You can cover the left eye with your hand if you want. How many dots do you see?
4 dots, 2 clear red dots and 2 blurry red dots.
Cover your right with your hand, please. Now, how many dots do you see?
4 dots again, 1 red dot and 3 green dots.
Okay, remove both your hands. Now, see how many dots you are able to see?
Again 4, same I think, 2 red and 2 green.
This clearly shows that patient does not have suppression for near and binocularity is present. Now we'll be checking the accommodative facility using the accommodative flippers of plus minus 2 diopters. Please look at the letters here. I will be putting some lenses in front of your eyes. Initially, the print will appear blur, then it will clear. Once it gets clear, you have to use the word now. Alright, then I'll be flipping the lenses and another pair of lenses will be there in front of you. Okay, we'll be doing this activity for 1 minute. Okay, please look.
Yeah.
Is this clear? Keep looking there. When it clears, say now. Clear?
No.
Clear?
No.
You can see that the patient has got difficulty with clearing with minus lenses, which shows that he has difficulty exerting accommodation or stimulating accommodation for near at 40 centimeters. Let's now look at the Virgin's facility using a 12 prism diopters base out and a 3 prism diopters base in Virgin's flipper. Please look at the print. When it is clear, use the word now. Is it clear?
Yes.
Now.
Yes. No.
Now.
Oh, no.
Now.
Yes. No. No. Just clear now.
Now.
No. 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 No.
As you can see, the patient is easily able to flip and clear the print through the lenses, through the prisms. So he does not have a Virgin's facility issue, whereas in case of an accommodative facility, the accommodative facility is reduced for near with patient having difficulty, particularly with minus lenses. To confirm the diagnosis further, whether the patient has convergence insufficiency or not, we are going to do the Virgin's amplitude test, which is the negative fusional Virgins and the positive fusional Virgins, and also will measure the AC by A ratio, which will give us a clear indication whether the patient has an accommodative convergence insufficiency, an accommodative insufficiency, or a convergence insufficiency. Let's begin with the test for near first. Please look at the words written here. Okay, I will put these prisms in front of your eyes. Initially the vision will become blur, then it will become double, and then again it will become clear. When you first notice the blur, you have to tell me whether it is blur. Then when it appears to be 2, you have to tell me, and when it becomes clear, please let me know. Okay, we'll begin with negative fusional Virgins, where we will put the base in, that is towards the nose.
Yeah.
Clear?
Yeah.
Clear?
Yeah.
Clear?
Yes.
Clear?
Yeah.
Clear?
Blur.
Blur?
Yeah.
Okay. Is it 1?
Yeah, but blur.
1? Single?
Yeah, sort of, but yeah, very, very blur now.
Single?
The earlier one, yeah, this is sort of double.
Double. Okay. Single?
Yeah, again blur, but this is more double now.
Single?
Blur.
Single?
Yeah, single.
Clear?
No, blur.
But it is single.
Yes.
Okay. Next, we will do the positive fusional Virgin test, where the base will be put away from the nose, that is outward, base out. Okay. Please look here at the print.
Yeah.
Is it clear? Clear
Yes.
and single?
Yes.
Clear and single?
Yes.
Clear and single?
Yes.
Clear and single?
Yes.
Clear and single?
Blur, very blur.
Blur?
Yes.
Okay. 1?
No, 2.
2?
Yeah.
Okay. Now?
Blur.
Single?
Sort of blur, but single.
Single?
Yeah.
Okay. Let's do it for the Right eye now.
Single, clear, 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 blur,
Blur.
yeah,
Now.
double,
Double.
yeah,
One.
little blur,
Blur.
yeah,
Clear.
yes,
Single. Clear.
no, already blur, but double,
Now.
blur,
Now.
double,
Single.
double,
Double.
yeah,
Now.
double, and blur, double and blur,
Now.
double, but not blur,
Now. Clear.
clear,
As you can see, both the negative fusional versions as well as the positive fusional versions for Neo are affected. We did it for both the eyes just to confirm our result that we got, but the positive fusional versions is affected a lot more than the negative fusional versions. This shows that the patient has got a convergence insufficiency definitely, along with also an accommodative infacility which is present. Okay, to confirm that he does not have anything for distance, we will once do the negative and the positive fusional versions test for distance also. Please look at the dots in the very first line. Okay. Ahead straight. Is it single and clear?
yes,
Single and clear.
blur,
Blur.
yeah,
Now.
this is blur but clear, like sort of clear,
Single.
yes,
Single.
blur,
Blur.
yes,
But single.
yes,
Single.
double,
Double.
yeah,
Okay. Single.
blur, but single,
Single.
Yeah.
Okay. Look at the dots, please. Head straight. Single.
yeah,
Single.
yeah,
Single.
yes,
Single.
blur, but single,
Single.
double,
Double.
yeah, definitely double,
What about now?
single blood blur,
Now.
little blur,
Okay.
single blur, this
Now?
is clear,
For distance, the PFE is also reduced, whereas the negative fusional versions is almost normal, which shows that the patient has definitely got an accommodative and a convergence insufficiency problem. Along with that, we need to even recheck his refraction just to make sure that the refractive error is proper in place. Let's do an AC by E ratio now. Since the patient is already wearing glasses, we will use those glasses to measure the AC by E ratio. First, we will do the prism measurement without the glasses and then with the glasses. Remove your glasses, please. Hold this in your hand. Can you see this word?
yeah,
I want you to keep looking there. When
left is clearer, right is blur,
hold it a little high, please. Alright, please wear your glasses now. Without the glasses, the patient has got near deviation of 12 prism diopters. Now let's see with the glasses. Please look here at the word. Okay. With the glasses, the patient has got a deviation of 8 prism diopters. Since he is wearing a -2 powered glasses, we come to know that the AC by A ratio is 4:1. That means the AC by A ratio is normal. This shows that the patient has got a pure convergence insufficiency with probably a little involvement of accommodative infacility present. Now going to share with you what are the exercises that we can give to the patient at home so that he is able to overcome this convergence insufficiency. First, we will do the pencil push-up test. Please hold this pen in your hand at the eyes level, at midpoint of your nose. You have to look only at the tip.
Okay.
Don't look behind. Look only at the tip of the pen. Alright? Slowly get it close, keeping it midway between your eyes. The point at which it becomes double, you have to stop.
Double.
Try to keep it single as long as possible by looking at the tip. If you feel tired, then close your eyes and take your hand back again. Again, look at the tip. Slowly get it close. The point at which it becomes double. Double, keep it one as long as possible. If you feel tired, close your eyes and you can lower your hand. This exercise, you need to do it at home twice in a day when you are fresh, not tired, not at the end of the day. In one turn, you have to do 15 to 20 times where you have to get the pen close to your nose. The point at which the appears double, try to make it single as long as possible. If you feel tired, close your eyes, take your hand back. Repeat this for at least 15 to 20 times in 2 turns in a day. Alright? You have to do this test for at least a month. Next test and the exercise that we are going to give to the patient for home is a barrel card. Hold this card at the tip of your nose, midline between both the eyes. What are you able to see now?
Red and green.
Okay, I need you to focus at the very last barrel that is there here in front of your eyes. Don't move your eyes, don't switch your eyes between red and green. You are supposed to see both the lines together. You have to keep on looking at the barrel till they become the red and green fuses and becomes one. You have to keep on fusing it as long as possible. But you have to keep on doing this exercise for at least 5 minutes in a day, minimum for 2 times.